The flu vaccination, a guide for parents and carers of people with a learning disability. Every year in England, lots of people of all ages get flu in autumn or winter. Flu can be very serious and is different from having a cold. If you have the flu, you might feel very hot, feel achy, or feel very tired. But people with a learning disability and some autistic people are more likely to suffer from health problems that make them more vulnerable to flu. The flu vaccination, sometimes called a flu jab or injection, is safe and will help more people stay well. We don't want people to end up in hospital. If the person you support has additional needs, you might be helping them make and attend that appointment to support them while they get their flu vaccination. People can get their flu vaccination every year in autumn to prepare for winter. If your family member or the person you care for is on the learning disability register at the GP practice, or if you are autistic and have certain health conditions, ask your doctors or pharmacy for advice. It is important to make an appointment as soon as you can before flu starts going round. If you are not contacted or they have not had their flu vaccination before, then speak to your GP surgery. If the person is under 18, they will be offered a nasal spray. People aged 18 and over are offered an injection. If they are really scared of needles, they might be able to get the nasal spray. But it is not as effective in adults, so it is best to have the injection if possible. Flu vaccinations are available at your doctors, pharmacy and supermarkets. You should support the person you care for to go to the place that suits them best. When you are booking a flu vaccination appointment, please be prepared to explain why you or the person you support should have it for free. It's best to get the flu vaccination as soon as possible before flu starts to go round. If the person you support is due an annual health check, ask the doctor if you can book their flu vaccination at the same time. You should be allowed to go with the person you care for if they need support from you. If you are told you cannot, tell them you are their carer and that a reasonable adjustment means you have to go in with them to support them with their needs and reduce anxiety. Sometimes carers are also called a care and welfare deputy. If you are the person by law who gives consent for the person you support, please make sure you tell the doctor or nurse this. The flu vaccination does not give people flu, but after having the flu vaccination, some people might feel a bit achy. They might feel like they are getting a cold. It might be sore on their arm where they had their injection. If they had the nasal spray, they might also have a runny or blocked nose. This is normal, but these things should only happen for a few days. Call NHS 111 if they carry on or get worse. Let's stay healthy together by getting a flu vaccination.